Here you can see India as well as the entire world is facing with lot of problems. And one by one, I'll enumerate the problems. The Indians are affected by lifestyle diseases at a much younger age. That means heart disease, cardiovascular disease and stroke, then diabetes, hypertension, obesity. So all these cancers, they are causing deaths in early age in Indians compared to the rest of the world. And also, there are various myths in the treatment, and people don't know where they should go for the unconventional therapies and where they should go for the interventions. And also, there are a lot of unconventional methods, they are being promoted for emergencies, which may be fatal. So people need to be aware about which therapy is useful at what time. And also we have various technological advances like robotics, percutaneous interventions, and people, they are confused whether they should go for this technology or that, and many times they are being over advertised for those patients who may not be suitable for that technology also. So we have to rationalize which technology is useful at what stage. And then there are other issues like there's growing stress among the healthcare professionals also and the general public also. And because of that, the cardiovascular disease is also increasing. And also there is some gap in the doctor-patient relationship also. So these are increasing in the last few decades, and also because a lot of emphasis is there on reducing the cost. And at the same time, we have to make sure that we don't reduce the quality. So we have to maintain a balance between reducing the cost and reducing the quality. So here you can see diabetes, hypertension, dyslipidemias. They are all causes of mortality, and nowadays heart attacks, they account for the maximum number of deaths. And then heart failure is also becoming a silent pandemic all over the world. And in India, it has become a very major problem. And because of the rising number of heart failure patients, their 5-year survival is very less. Like 31% of the heart failure patients die within 1 year, and 45% die between 3 years. And by 5 years, almost 60% of the patients, they are going to die. In India, the most common cause of heart failure is that patients, they get a heart attack and they come to the hospital late. Because of that, a lot of Indians, they are suffering from heart failure at a much younger age. And here I'll tell you that heart failure has other causes. Apart from heart attacks, it can be because of obesity, diabetes, hypertension, or it may be because of, there's another thing that has increased the incidence of heart failure nowadays and heart attacks nowadays is the increasing stress. This is rising not only in men, it is rising in the women also. And at the same time, it is rising not only in the urban areas, it is rising in the rural areas also. Fortunately, there are some risk factors which are under control, but unfortunately, other risk factors are not under control. That means your gender, like some diseases, they are common in females, some diseases, they are more prominent in males. Then hereditary, like if your parents were affected, you will also be most likely affected, and you may be affected at a much younger age. And also, it has been seen that Indians, they are most prone to heart attacks compared to other races. And as you grow older, the risk of getting heart disease increases. So here you can see that why we should be worried, because Indians, they have the highest risk. If you compare to Americans, we have 4 times more high risk. If you compare to Chinese, 6 times more, we are 20 times more prone to heart disease compared to Japanese. And in our population, heart attacks occur at a much younger age. 50% of the heart attack patients, they are younger than 50 years, and almost 25% they are younger than 40 years. So you can imagine, if you compare to the Western world, here you can see that most of the Indians, they get heart attacks between the age less than 65. But in Americans, only 12% patients, they are below 65. Rest of the population is above 65. And even in China, only 20% of the patients, they get a heart attack before the age of 65. In India, we are getting even in their 20s. Every day you hear in the news that young population, they suddenly they go to the gym and suddenly they die. So this is becoming very common. The worst thing that has happened is the COVID. And after COVID, a lot of cardiac complications are being seen. So the number of sudden heart attacks and sudden deaths, that has risen after COVID. And we have seen that there is a 29.9% increase in the sudden death among the population 25 to 44 years. So this is happening among young populations. This is also happening in the other elder populations also, but in the 45 to 64, the rise is 19%, and above 65, it is 13%. So comparatively, the young Indians, they are dying more frequently now. So the reason is that there is a increase in the thrombus formation after heart attack, which can suddenly precipitate the heart attack. And also in young population, they don't have collateral circulation because their arteries, collateral small arteries, they are not well developed. So when they have a heart attack, the blood supply to the entire heart muscle suddenly stops. So they are likely to die suddenly. Apart from this, everybody must understand that heart disease is not a disease that will occur to you as you grow older. So since birth, your arteries, they start getting the deposit of cholesterol in their walls, and these walls suddenly are not going to crack. They will crack slowly. The lipid will keep on depositing, and they will become hard, rigid, and then when suddenly one day, if there is a crack in the wall, then the clot will form and it will cause a heart attack. So how fast this will progress depends on our hereditary risk factors and also in our lifestyle. So today I will tell you briefly about how we can, mainly we should focus on prevention, but I will also tell you about the technological advances that we have made in the management of heart disease once the heart disease occurs. Almost 60 million people die every year across the globe, and out of this, 20 million people, they die because of heart disease. So that means 1 out of 3 person will die because of heart disease. But we think that we are not going to have a heart disease. So ultimately, as you grow older, one by one, every third person is going to be affected by heart disease. And you'll be very surprised to know that 80% of heart disease is preventable. But people are not focusing on the prevention at all. So here I'll show you this figure. You can see that we have common risk factors for most of the lifestyle diseases like tobacco abuse, alcohol abuse, high cholesterol levels, blood pressure, diet, physical inactivity, and obesity. These can cause cardiovascular disease, can cause cancer, can cause lung disease, can cause diabetes. And it has been many studies have shown that once you get one particular disease, then you are prone to get other lifestyle diseases also. Like if a patient has heart attack, then patient may later on get cancer also. And if a patient has cancer, patient may later on die because of heart disease. So the risk factors are common, but one person, if having multiple risk factors, you are prone not only to heart disease, you are prone to other lifestyle diseases also. So fortunately, we have risk factors which we can control. So what are those risk factors? So these risk factors are like high blood pressure. So nowadays we see young population, we conducted surveys in universities and colleges. We found that almost 20% of the students, they were likely to have high blood pressure later on. So they were in the pre-hypertensive stage. And almost 20 to 25% of the students, they were likely to get diabetes later on in their life, and they were in the pre-diabetic stage. So this is very, very alarming because youngsters getting these problems and they are not aware about it. And once there was a girl who was just 22 years old and her blood sugar tested more than 430. And she was not even aware. She was just perfectly fit looking. Physically, she was looking absolutely fit. But her sugar level was 430. So normal sugar level should be less than 100, fasting. So what should we do? So first of all, we have to understand that heart disease occurs because of the interrelationship between the hereditary as well as the lifestyle risk factors. So some people say that they don't smoke, but why we got heart attack? We don't drink, why we got heart attack? So it is not just one thing. Some people have a normal cholesterol, they are thin, lean, but still they get a heart attack. So we have to understand that there are multiple risk factors, and the correlation between the risk factors as well as the hereditary factors, they play a big part in your incidence of getting heart attacks. So we have multiple risk factors, then heart attack risk keeps on increasing. Your risk will become 2 times with 2 risk factors, 3 times with 3 risk factors, every risk factor added to your life. So it is going to increase our risk. So what we should do, first of all, when you are young, since you're teenage, you should first of all identify your risk factors. And identification of risk factor is the first step towards preventing yourself having the heart disease. So once we identify, then we can find solution that how we are going to prevent this risk factor from affecting our heart. So then once we have diabetes, it increases the chance of heart attack also, and also it increases the chance of other diseases like kidney failure and so many other problems, like you have hemorrhages in your eye, you can have more prone to stroke also. So all these risk factors, they can have effect on your health because of simple rise in your blood sugar levels. And as your sugar rise higher, once your 3-month average, that is HbA1c, once it is more than 6.5, then you enter the danger zone, and above 7, it can affect your organs, it can damage them permanently also. Also, once your blood pressure starts rising, so if the blood pressure is above 130, your risk of getting stroke, it increases suddenly, and also it increases the risk of getting heart attacks. So everybody must know about your blood pressure, what is your blood pressure, and you should monitor it, and you should also make sure that it is not rising. It may rise because of stress. Some people, they think that blood pressure may not occur to them till they become old. But actually what is happening is that when you are walking on a road and suddenly a dog starts running after you, so your adrenaline will be secreted in your circulation, and it will increase the pumping of the heart, it will increase the heart rate, it will increase your blood pressure, and it will increase your blood sugar also. That is a natural way of mobilizing the resources for your organs so that your muscle can act quickly, you can run faster than you normally do, and you can overcome the danger, or you can either fight or you can flight. So that means the body is preparing you for an emergency. But some people, they have a continuous dog running after them in their minds. So they keep on having stress throughout. They will keep on worrying about things which are not going to happen, and they will keep on thinking that some calamity is going to come, which has not come yet. So because of this constant worry, the dog is running in your mind and your adrenaline is rushing in your blood. So because of that, we become prone to get this heart disease, diabetes, high blood pressure, your cholesterol may rise, and you become prone to get the heart attacks and stroke, as well as other diseases like cancers. Not only the blockages in the artery cause heart attack, blockage in the brain may cause a stroke, blockages in your legs can also occur because of this cholesterol deposition. And many people, they require intervention because of that, and some people may lose their limbs also. You have to do amputation if the blood circulation to your legs, it blocks. So these are interrelated. So once you have one problem, then other problems are also likely to occur. Then what are the ways we treat it? Nowadays we think that only when we get the blockage, we should go to the hospital and get ourselves treated. Means you get stenting done, or you get a bypass done. For leg also you do the same. For stroke also we do the same. But actually that is not true, because in 2011 we started a global trust called Cardiomurgeon. So Cardiomurgeon is basically, cardio means heart, and mergeon means merger of all the specialties and everybody who is concerned about the heart. So we need team approach to deliver best cardiac treatment to anybody. So it cannot be done by a single person. I will tell you, give you a simple example that in your journey of life, we are blindly running and running and running. We are running on the roads, we are honking on the red lights, and once you seek entry in the school, competition starts. You want to come first in your academics, you want to come first in your singing, you want to come first in dance class also. Everybody is competing to come first. But actually what we are achieving is, we are burning ourselves out, and we are likely to, once you race towards the journey, then what is your destination? What is the destination of life? Death. So everybody clap for her. But this is not something to be happy. Actually, we are blindly racing towards our death. the faster we run, the early we are going to die. So here I'll explain to you how. So this is the journey of life. Suppose when we are born, after that, till we are a teenager, we don't have any risk factors, and that if that stage we start taking care of our health, it is the primordial prevention. If we cross that stage, then we come to the primary prevention, like we have acquired some risk factor, but we start controlling them. After that comes the early diagnosis. When we know the risk factors, we diagnose them and we start getting early treatment. Treatment may not be medicine, it could be yoga, it could be some physical activity, diet control. So that is the early stage. After that, again, you might require some medical management, and you can prevent the occurrence of complications. But if you have a complication, then you have to immediately take some intervention so that you don't lose the muscle of your heart and you don't become a heart failure patient, and you don't die suddenly. So after that also, treatment is not ending. You have to go for rehabilitation so that you can go back to your normal work, and also after that you have to do secondary prevention so that the disease doesn't come back again. So this is the entire spectrum, and we need a team of specialists. Like we need doctors, we need dietitians, we need physiotherapists, we need nurses, we need healthcare professionals, and we need psychologists, we need psychiatrists, we need like yoga therapists. So everybody help to come together to prevent your heart disease.